I'm Kathy Olewski, and I'm the 2021 host of the Road to Wellness Educational Webinar Series. I'm a patient, just like many of you, living with vasculitis. Some routine blood work followed by a kidney biopsy confirmed the diagnosis of ANCA-MPA in 2008. I was in treatment for 6 years, and I'm extremely grateful to have been in remission and off treatment for 7 years. In today's webinar, we will talk about 4 home health products that you should own. And our special guest today is registered nurse Jane Thomas. Jane has practiced nursing for the past 50 years, specializing in cardiology and working in a variety of settings, including ICUs, doctor's offices, cardiac rehab, progressive care telemetry, and most recently in a cardiac stress lab, cardiovascular ultrasound nuclear medicine. She enjoyed working at Emory University Hospital in Atlanta, Georgia for 31 years, and now works part-time at Advent Health Orlando campus after moving to Orlando 3 years ago. Her husband, Joe, was diagnosed with GPA in 1996 when it was still called Wegener's, and had several renal and pulmonary flares before his disease was finally controlled. Thankfully, he's been in remission and off all meds for about 10 years now. They joined the Vasculitis Foundation in 1998 and have received amazing support and knowledge and have made many friends over the years. And Jane has been an area contact. She was an area contact for the Vasculitis Foundation in Atlanta and the leader of the Vasculitis Foundation support group of Atlanta before they moved to Orlando in 2017. And before we get started today, I would like to stress a few important points. The Vasculitis Foundation is not endorsing any particular product or brand of device that we show you today. Everyone should do their own research and ask their doctor about any recommendations. And in this webinar today, we'll give some generic information about the home health products. However, it's important that you read and understand your specific device. We also don't want you to make any changes to your care based on the results from these devices. Always talk with your doctor and express concerns or questions. Better yet, take the device to your doctor's appointment and get expert advice. And now I'd like to welcome Jane and say thanks for sharing your knowledge with us today. And I'd like to start by asking you, Jane, to tell us a little bit about blood pressure machines. And I think whenever you're ready, I'm going to put my blood pressure cuff on so you can tell me if I'm doing it correctly.
Thank you very much, Kathy, for that introduction. And I want everyone to know that I'm really excited about being part of this webinar. And my husband and I have really had a lot of support over the years. As Kathy mentioned, my husband was diagnosed with vasculitis in 1996. So we've been around a long time as far as the Vasculitis Foundation goes, and seeing the growth and the wonderful care and information that it gives patients. So I'm happy to be able to help out with this. And Kathy and I are going to be interacting with each other, and it's kind of going to be like a little show and tell as far as our equipment, the different machines, what's happening with them, and to try to give you some tips for how to best utilize those things at home. So we're going to start off with the blood pressure machine, and I'm sure most of you have seen blood pressure machines. You have had your blood pressure taken in the doctor's office, at the hospital, in different clinics. And actually the taking of the blood pressure is the most common medical procedure done. So, when you have these things at home, you're in good company with having had blood pressure taken all over the world by everybody. So what is the blood pressure? Well, I need to start off by talking about the heart. And the heart is a muscle, and that muscle, the job of the heart is to squeeze and to push blood out through the body. And that blood goes up to the brain, it goes to the lungs, it goes to the heart itself, it goes to the kidneys, it goes everywhere. And so when the heart squeezes, it pushes the blood out. And then when it relaxes, the heart relaxes and fills up. So that force or that pressure of the blood in the arteries is what we're measuring. And the blood pressure machine itself will give you a systolic pressure and a diastolic pressure. And I'm sure some of you have thought, well, I have no idea what that means. And the upper number, if you look at, and I'm going to show my little card here, from my blood pressure machine, if you see a top number and a bottom number, well, that top number is the systolic number, and the bottom number is what's called the diastolic number. So when the heart squeezes, that's known as systole, and that the pressure increases in the arteries, and that's what's supposed to happen when the blood goes out through the body. When the heart relaxes after it squeezes, the reason it has to relax is so it can fill up with blood. So the blood is returning through the veins into the heart. And so the next time it squeezes, it can go out. Now that diastolic, the bottom number, is the relaxation phase of the heart. And that relaxation phase is transferred into the arteries also, and they have a time to relax. Because if your arteries were squeezed down all the time or had a really high pressure all the time, that's going to lead to a lot of problems. So we have systole is the top number, diastole is the bottom number, squeezing, working, and diastole is resting. And many times people will ask, well, what is the normal blood pressure? When I graduated from nursing school, I was taught the normal blood pressure, and that was back in 1970, by the way. So things have changed a lot, but the normal blood pressure was considered about 20/80. Now, in reality, the blood pressure can vary between about 100/60 up to about 120 or 130/80, and that's considered the normal range. So in one of the reasons that we need to keep a watch on the blood pressure is because high blood pressure, also known as hypertension, is the number one risk factor for developing cardiovascular. Since people with vasculitis have problems with the arteries and with blood, with the veins, that's cardiovascular disease. So cardiovascular diseases, including in that, is heart attack, stroke, congestive heart failure. Those types of things are cardiovascular diseases. And the hypertension, the results of hypertension in 2020, that was the leading cause of death throughout the world. So this is something that we really need to keep a close check on, and it's easy to do in our homes. Also, another thing to do, and we'll talk a little bit more about this at the end of the program, is when you're monitoring things like your blood pressure, you might want to keep a record. And my blood pressure cuff actually came with a little daily monitoring log. So you can keep check on that. Now, I know that a lot of people have smart devices these days, and you have various ways of keeping check, but just know that it's important to keep a daily log at first if the doctor's asking you to check your pressure, and then to decrease that if the doctor wants you to later on. Now, the trend of the blood pressure is an important thing to keep a watch on. So and generally, when you want to check your blood pressure, we're going to give you some tips on the best way to do that. So Kathy and I are going to show you the things to do, and I'm going to show you my machine, and she has a machine also. I see. For my machine, it shows you a systolic pressure, which is the top number, as we talked about, and a diastolic pressure, which is the bottom number. The machine also monitors your heart rate, and that is the pulse. So if you felt your pulse at your wrist or at your neck, that would be what's showing up on the monitor also. So one of the important things to know about taking a blood pressure is to use the right size cuff. And I imagine not many of you have thought about the right size cuff, but if the cuff is too tight, then that increases the blood pressure and gives you an errant reading. If the blood pressure cuff is too loose, that makes you have a lower blood pressure or reading. So it's important to have the right size cuff. And Kathy, I know on your cuff, I think you said that it didn't show exactly the marks on that. Is that right?
Well, let's see. It just basically shows These are the directions.
Where to place it?
Yeah, the only directions and that I had.
And most blood pressure cuffs come with directions. Most of these things that we'll be talking about come with directions. So pay close attention to the directions. The thing I wanted to show you on my cuff is that it has marks that show you at the bottom that that's how wide, how big, that's a monitor of how much width you have. And on my blood pressure cuff, the width of the blood pressure cuff could go from 8 inches around the arm all the way up to about 11 inches and 11.8 inches. And when I checked my arm circumference, it was right about 10 inches. And that just gives you kind of an idea of how much. If you have a really fat arm, you're going to need a bigger blood pressure cuff. If you have a little tiny arm, you're going to need a smaller blood pressure cuff to get the accurate reading of that. So, Kathy, we're going to demonstrate how to put it on the arm correctly. And Kathy's is putting it on her arm. She's going to roll it over so that it's Velcroed on. And don't pull it real tight. You want to be able to put a couple of fingers up underneath it. And Kathy can show us that, right? But you certainly don't want it so loose that it's going to fall off. Now, the other thing to remember, and mine has an artery mark. We're going to put that little mark area over the brachial artery. Now, I know that most people are not going to go around feeling their brachial artery, but that's one thing that you can do. And the brachial artery, if you say, well, where's my brachial artery? That if you follow your little finger all the way up to the bend of your elbow and you measure that, that's where the brachial artery is. And Kathy, and you can feel probably a pretty good pulse there. Is that right?
I can feel it beating right there.
Yes, that's right. So heart rate, and the blood pressure cuff will measure the systolic pressure when the heart's squeezing and the diastolic pressure when it's resting. He's demonstrating for you that the tubing of the blood pressure cuff is going down her arm. It's not looped up over her shoulder. It's not dangling down on the floor. It's going down toward her little finger, and that's the correct position for it. So when you are going to check your blood pressure, the best thing to do is to sit. This is just checking your normal blood pressure. Remember, the blood pressure can be checked sitting. You can check it lying, or you can check it standing up. But we're going to be right now talking about the sitting. So you want to sit. You want to relax your arm on a table or on the arm of a chair. And you want the cuff at about the level of your heart. And your heart is over to the left of the sternum, and it's in the center, upper center of the body. So you can see that the blood pressure cuff is up around the level of Kathy's heart. So your arm is relaxed, your feet are on the floor, both feet on the floor, and your arms and legs are uncrossed. Now it's important not to talk, not to fidget around, not to move your arm or tap your hands and that type of thing. So you want to sit quietly with your arm relaxed, feet on the floor. It's best to have your back supported by the back of a chair or the back of a couch or something like that, but not slumped way down. So you're in a supported position. And then you're going to punch the button on your machine and have it monitor the blood pressure. Now, you'll feel a squeeze, obviously, but remember that squeeze is not going to last long. It may seem really tight. You may seem, oh my gosh, this is going to hurt. It's never going to get better. But that pressure is going to come down because the blood pressure cuff has to squeeze above what your systolic blood pressure is. So if you feel it really, really tight and not coming down very well, it's having trouble hearing that first sound. So just remember, it is going to come down, and life will go on. So it's important to do those things that we talked about. And if you want to check your blood pressure lying down, you can just lay down on the bed and put the blood pressure cuff on your arm like you did. Have it at the same height as your heart. And standing up is the same thing. You would hold your arm down by your body so that the blood pressure cuff was about the same level of your heart. You might wonder why do we care if it's different, lying, sitting, and standing? And some doctors may ask you, to please check it that way, because the blood pressure is supposed to be lower when you're laying down resting than it is when you're standing up or sitting up and moving around, because that gets the blood up to your brain, and that way you don't faint. Because that's one of the things that can happen. And so if you tell your doctor, I am really feeling lightheaded and weak and dizzy at times, he may ask you to check your blood pressure lying and standing also. So the next thing we'll talk about as far as blood pressure is we talked about the normal blood pressure. And in 2017, the American Heart Association, American College of Cardiology put out new guidelines for hypertension. And those guidelines said that your blood pressure needed to be much lower than many people were comfortable with. So it's important for you to ask your doctor, what parameter are you looking for as my blood pressure? Many doctors these days are saying if your blood pressure is greater than 130/85, then that's a problem. So we want to make sure that you check with your doctor and know what your parameter is, and that he can watch out for any kind of things that might be making your pressure be higher or lower. Now, what are some of the things that can influence blood pressure? There are quite a few things, actually, and the blood pressure actually is generated from your brain and your heart. And so there are a lot of things that could go on between the nervous system and the heart. Like when you're exercising, your blood pressure is going to go up and your heart rate is going to go up. That's the normal response. If you have a fever, your blood pressure and your heart rate frequently will go up. There are medications such as prednisone can make your heart rate go up. Caffeine, smoking, obesity, eating a lot of salt, those kind of things can all increase the blood pressure. One of the things that I think in non-steroidal anti-inflammatory medications can certainly make the blood pressure go up. And also one of the important things I think for vasculitis patients and others to keep in mind, and I think this is one thing that was affecting my husband's blood pressure, was obstructive sleep apnea. And those people with obstructive sleep apnea can have hypertension during the night and they don't even know it. And that can cause the blood pressure to be up even higher and can mask blood pressure, hypertension, if you're not monitoring your blood pressure all the time, which most people don't. So I think that's a really important thing to keep in mind, is obstructive sleep apnea. And people with vasculitis certainly can have problems with that because of the sinuses and because of the trachea and those things. So be sure and take care of blood pressure of obstructive sleep apnea. What are some things that can decrease blood pressure? Well, of course, blood pressure medicines decrease blood pressure, and that's a good thing. But, a lot of times I'll have patients that'll say to me, well, I stopped taking my blood pressure medicine because it was so good. And my answer, and most doctors' answers, would be, well, it's low and it's good because you're taking your medicine. So make every effort not to stop any medications without talking to your doctor about that. So medications can lower it. Dehydration can lower blood pressure. And particularly that can make your blood pressure drop down when you stand up. So that's a real important thing to check, is if you're not drinking and eating enough, if you have severe weight loss, is another thing. And in some diseases, like my husband has Parkinson's disease now, Parkinson's disease can have a lot of bad effects on the autonomic nervous system, and that can cause lowering of the blood pressure when you stand up. So increased blood pressure too high and decreased blood pressure too low are some things that can be real problems. Now, Kathy, we talked about, I think when we were, practicing and discussing this, was some people have been using wrist blood pressure cuffs. So that's not something, when I was doing research for to talk about this, there was some controversy about blood pressure cuffs being used on the wrist as the standard, but some doctors do that. And so if you have a wrist blood pressure cuff, and it does fit right around the wrist, and it tells you where to put it over the radial artery, if you have a blood pressure cuff that's like that, be sure and take it to the doctor so you can calibrate, make certain that your blood pressure at your wrist is the same as what it is in the doctor's office. Another thing I forgot to mention a little earlier is that when you're getting ready to check your blood pressure, please be sure and check it over your skin. And Kathy and I both have on short sleeve shirts so that we could show you that. But if you have it over the clothes, if you have something bunched up underneath the blood pressure cuff, that's going to give you an abnormal reading.
How about if we go over, I will put on the cuff and see if I do it properly and actually take so this is my, I think it looks a little bit like your blood pressure monitor. It's one that you just push the button on. Mine, one thing that I learned about mine when I was going through this process is that mine has batteries inside it. So I can take it with me wherever I need to take it, but it also has a plug that goes into it so that if the battery's like it's not working, I just didn't realize that when I first got it, is that I have
okay. So your actual machine plugs into the wall? It has a wall outlet?
It has an adapter to plug it in, but I can also use it without the adapter on batteries.
Right.
Batteries have not run down, but it was giving me an error code, an E something, and I realized the batteries had run down and I needed to plug it in.
Right.
So that's just one more little thing. So I've put it on pretty much the way that you taught me, just felt where the brachial artery is. My feet are flat on the floor. My back is supported there.
Right.
My arm right there on my desk. Is that about right?
That's right. And you have it over your skin. It's
I
not
do.
over some.
I had a sweater on earlier, but I took it off because I knew we were going to do this the right way.
And I will mention to you that if you, let's just say you went to the doctor's office and they're going to put it over there and you'll say, oh, I'm going to push my shirt up or my sweater up or whatever. It's fine if you push it up, as long as it's not something that's tight. You know, some shirts are kind of tighter at the bottom than they are at the top because you don't want it the clothes or whatever is above it to be tight. So you might just slip your arm out of if it's a long sleeve, if it is tight above that.
I was being seen by my doctor and I was having some blood pressure issues. My blood pressure was going low in the morning and high at night. And they asked me to record my blood pressure at different times during the day. And also we talked about not panicking if my blood pressure looked like something I wasn't used to, but then to take a break and do it again and actually take my blood pressure 3 times, but like wait a minute in between or something like that. Is that correct?
Yes, that's very good advice. And I think, remember that when your blood pressure cuff is squeezing on your arm, that squeezes the blood vessels and they need time to relax. So if you're going to check it again, I would suggest waiting probably at least 1 minute, but better to wait 2 minutes or so. And getting an average of your blood pressure and averaging that together and saying, this is what my blood pressure is a good way to do it. The doctor that way will be able to have the most accurate pressures. Now, there's some people that have blood pressures that go up when they lay down. And so that's another thing that's kind of hard to treat, because if it's higher when you're laying down than it is when you're standing up, some people can have problems with weakness and dizziness. But your doctor was right in having you check it several different times. Most of the time, blood pressure is lower in the morning than it is at night. And so not that it's so low that it's going to cause you symptoms, but when you're up and about and you're doing your usual daily activities, the pressure is generally a little higher, which is quite normal.
One of the questions that I had for you was that there's something that I've heard called I think it's called white coat syndrome, where you get to the doctor's office and you've been running around and you're almost late to your appointment, and you sit down and they take your blood pressure and it's like way higher than you think it should be. Is there some truth to that?
Oh, there's absolute truth to that. And that's called white coat syndrome, actually. It has its own syndrome name. So it is very common. And, you know, some people are just anxious when they go to the doctor. And as I mentioned, blood pressure is a lot of how the blood pressure works is generated in the brain and in the nervous system. So anxiety is something that can certainly increase that. And so sometimes doctors, if they realize that your blood pressure is high when you come in, let's just say it's 160/90, they're going to hopefully let you sit and relax for at least 5 minutes, no talking, just relaxing there and letting that come down. Some doctors will have you wait until the appointment is over and they'll check your blood pressure again. So I think that's a very valid thing. Also, that's another reason why having a home blood pressure cuff and monitoring the blood pressure on a regular basis and getting an average, that can really help. And measuring it in the morning and in the evening, that can help. And all of that together can help the doctor say, well, this really is probably white coat syndrome and not hypertension in general.
Right. And I've experienced those things. So that's why I wondered. I know that I was asked to record my blood pressure 4 times a day. It was like 10 in the morning, 2 in the afternoon, 6 p.m. and 10 p.m. or something like that. And I knew that I wasn't supposed to analyze it. I was just supposed to record it and bring it to my doctor and let them analyze it. So that's what I had one more question. There are different size cuffs, right? Like I remember when I was looking on Amazon to purchase my meter, that my my blood pressure machine, that my doctor she didn't recommend a specific brand, but there were different size cuffs, and some are for children, right?
Well, I think that's an important point, because if you have a child and the doctor wants you to check their blood pressure, you're definitely going to need to use a pediatric blood pressure cuff. And those can be bought. The different sizes, you know, and I'm not trying to say go to a certain website, but there are definitely sites where people like to buy things. And those websites do offer different size blood pressure cuffs. Now, I'm not sure, to tell you the truth, if the drugstores where I bought my blood pressure machine, if they have different size blood pressure cuffs there, I would think they probably do. But even if the drugstore doesn't have them, I'm sure that the company that makes the blood pressure machine, you could go on their website and order different size blood pressure cuffs, because it's really is important. And the doctor, if he wants you to use a special pediatric size blood pressure cuff, would need to let you know that. The information that I read about it, and, you know, I think it's important to know that a child is not a small adult. And so check with the doctor, the pediatrician, about it, and make sure that you're checking the child's blood pressure exactly how they want to have it done.
That all sounds like great advice. Yeah. So I just want to end up today by saying thank you to you, Jane, for being our medical knowledge today and helping us interpret all these things. I learned so much from you today.
Thank you.
Just the diastolic systolic thing was a big mystery to me, so I appreciate all that. Thanks today to ChemoCentrix, Genentech, and Amgen as our sponsors of patient education for the Vasculitis Foundation.